Good afternoon and welcome to today's webinar, CQC Ready. Make sure your care notes, audits and management reports are ready for CQC inspections. If you have missed the previous webinars, we do one a month. If you go to our website, www.carebeans.co.uk, there is a little section at the top, so you can register for future webinars. It says webinars. And then we also have a brand new section, which is free care resources or resource packs. And this will give you all the information from our previous webinars, along with the knowledge base sheet that we do for each of our webinars as well. So that's a really nice resource. It's completely free to customers and non-customers. And if you do want to have a look at our system, please go onto the website and you can book a demo if you wish as well. So we're going to get straight into today's webinar, CQC Ready, making sure your notes, audits, management reports are ready for CQC inspections. Points to be covered today are CQC inspections, getting ready for CQC, ensuring compliance, robust care planning, and evidencing safe, effective, caring, responsive, and well-led care. As you all know, there's 5 key lines of inquiry that CQC inspectors use to inspect a service. During this webinar, we will be suggesting how to evidence that you are meeting these requirements and where on the system to ensure compliance. Don't worry if you're in other parts of the country like Wales, Northern Ireland, Scotland, etc. This webinar will still obviously be relevant to you because they're very similar, the key lines of inquiry, and what your inspector will be inspecting your home. The system is built in a way that it covers all inspectorate requirements. So we're going to go through, we're going to use CQC Chloe's for this example, and we're going to be using the CareBeans software to demonstrate this. So the first Chloe we're looking at is safe, and the first one, there's 5 in this section. How are people protected from bullying, harassment, avoiding harm and abuse that may breach their human rights? So within our system, we have care plans to ensure that people are protected from bullying, harassment, avoiding harm and abuse. We also have safeguarding forms. So I'm going to go through each one. We're going to use the system, just give you a few scenarios and show you how we tackle these kind of things. So normal sign-in procedure, obviously security, very important. So if we go into the service user, and here we're going to identify a service user. We're going to use Sally for our example today. We're going to use Sally Hall. Okay, so here what you can basically see on Sally, you've got 1, 2, 3, 4, 5, 6, 7 care plans that are active because she's only got these areas of care that she needs to be concentrated on. And down here, all are her other care plans. So if you do need to add another care plan in, we do a suite of 20 for you. So if she's living with dementia, it's very simple. You can activate it by going in this section and pressing activate. And then what that will then do, it will then drop that particular care plan up into the active section. Okay, I didn't save that because obviously we're just concentrating on these areas of care today for Sally. So the first part of this was obviously care plans, evidencing that dignity and respect is being maintained. Service users are not discriminated against because of their age, disability, sex, gender, race, religion, belief, or sexual orientation. And then the second part of this is safeguarding forms. So the care plans will cover most of the information. And within here, you see we have a review section. So Sally was involved in her care. We have all the necessary assessments to ensure that she's safe. We have the care plan. And then we also have the care plan risk profiling, which we'll go into a little bit later. We have the body map. So if there's any body map issues. And then we have the care actions, which follow on from obviously Sally's care to ensure that the care plan is being followed. We have a full history, so when things are reviewed. And we have consent and mental capacity to ensure that anything she may need consent for or she's lacking capacity, they're all here, all detailed for you in the report. So that's how the care plans are summarised. Within each plan of care, we ensure that people are protected from bullying, harassment, avoiding harm. Obviously, within the care plan, you've got what are the needs, what are the desired goals, and how we're going to achieve these goals. Okay, so they're all listed, detailed within the report here. So in the care plan, sorry. So up here, we've then got a separate section. This is our integrated incident accident recording system. So what you can do in here is you can see we can obviously add safeguarding and concerns as an incident type. So if you go into the safeguarding form, for example, this is where you can create a safeguard. So if you've got a concern, it might be in room 6, what happened before the incident, description of the incident, what immediate action was taken, who is involved. So you can obviously sit in here and say it was Sally Hall, for example. If there was any injuries, you can obviously say it might have been shock or sprain and the comments. And then you assess the safeguarding issue. So what the safeguarding issue was, how did you ensure the safety of the well-being? And it produces the correct form for you. So it's already laid out for you. You don't need to think up your own forms. They're all on here for you. So you can do a proper full assessment of a safeguarding issue. We also have another one here, which I've already conducted. And once you've filled in your form, it then goes onto your operations dashboard, where the managers can then go into here and they can review, they can assess, and they can also do additional actions. So they can do is a riddle required. And if you click there, it will open the necessary form for you to fill in. Okay, so it's a full integrated incident accident recording system. It's got a review. We've put a review in for a week's time. The family have been notified, and this is where you can basically give a tale of what's happened, and you can write commentaries as well to say spoken to family, for example. And then it's got a really nice reporting function. So if you do want to print this off, if you press print button, you can print it to a PDF and it will produce a really nice report with all the information. So if CQC need to see anything, they can see it in one clear, easier format. The safeguard and concern incident forms are available to help protect people who are using the service by reporting concerns and potential definite abuse if there are any concerns. So that's how we're obviously using that in our S1 Chloe safeguard. So key line of inquiry number 2, safe. Number 2, how are risks to individuals in the service managed so people are protected and their freedom is supported and respected? So what we have here, it's quite a lot in this one. We have evidence-based risk assessments, so Waterloo's, must tools, depression scales, to ascertain risk levels and plan care accordingly. We have risk assessments, evidence that the service users have participated in the risk management. There's always a risk. Risk assessing is about minimizing risk as much as possible without the freedoms. It's no good being safe if you're miserable, and that's a little quote from Jane Mumby. Evidence that the support you are giving is the least restrictive possible as well, which is really important. We also have the additional added actions to support safe service user to live an independent life as possible, and risk management reports, so you can see trends and analysis. So there's quite a lot there. We're going to go through them one by one on the system. So we're going to go up onto the system. We're going to click onto the service user. Just going to leave this section. And again, we're going to use Sally Hall for this example. Pretty straightforward, but this is just a little filter. We do have 2 Sally Halls in this particular home, but you can just basically filter out like that. So we're going to use Sally for this particular incident. So if we go into Sally's care plans, we have a raft of assessments that you can use. So at the moment, she has a personal evacuation plan, a bed rails assessment, a must tool, and a falls tool. Okay, so these can all be linked to care plans. So when you're reading them, they can actually be linked to an individual plan of care. So the bed rails might be on, for example, washing and dressing, for example, and you can link it to whatever care plan you like. These are the assessments we've chosen for her plan, but obviously you can add all these other assessments in as well. So we have wellbeing assessment tools, Cornell depression scales, with and without dementia, Waterloo pressure ulcer tools, moving and handling, Abbey pain scale, mouth care assessments, choking risk, Braden, COVID-19, suspected UTI, and the MUAC as well, to name just a few of our assessments that you can add to the system if it's relevant for the individual service user. So we call these, as we say, Sally's assessments / risk assessments, but we also have the ability to risk profile. Okay, so this is where the risk profiles come in. So risk assessment, evidencing that service users have participated in the risk. So we have here one for choking. So if you view it, it's a choking risk. We've got some notes in there. Please consider assault team referral. Risk of choking. Is the risk score serious? And it's rare, so it gives them a low risk. Sally is at risk of choking if flu's not hot enough. What the risk triggers are, who might be harmed, and the risk management. And you can ensure that consent is provided by doing a mental capacity or consent form here. So we have one for day-to-day care, and we've got one for personal care, got one for dressing change, one for bed rails, and one for meal times. So you can ensure, obviously, the participation in their risk assessment so they're safe. And then alongside all of this, we then obviously have the care plans. And within the care plans, you have actions. So on Sally, we also have a list of actions to ensure that the care plan's followed. So under washing and dressing, we have a personal care action. And on here, it'll say washing, personal care. And you can put alerts in, so it alerts you every hour, 2 hours, every day, every 10 minutes, whenever you want. And this has the person-centered care instructions in there for them. And then we've provided a person-centered checklist for that individual. And then the carer will then go onto their app or the web page, and they will be able to tick these actions off if they've done them every day, every 2 days. If they do go overdue, it will alert the system automatically. So it's got automatic alerts on you, so you don't have to worry about that. And obviously we have instant accident safeguarding forms, which I showed you earlier up here. So we've obviously gone through that, where you have all of the different types of instant accident, fall, near miss, and safeguarding forms. So that's how we can cover S2, how our risks to individuals and service users manage. Please make sure that you add whatever risks, whatever actions you need. And then, as we said, there is reporting for the management. So down here, you've got reports. If you go to report management, you can do some analysis. So you can do, for example, an instant trend report or an instant summary report. And if you want to do your whole home, you can then see how many incidents have occurred, when they occurred, and you can obviously select the date range there as well. You also have the ability to do that for the care provider risk summary, and this will give you a fantastic report for CQC showing you all your risks, where the risks are, and then you can obviously show them what actions you're taking to prevent these risks via the care plan risk profile. So it's a really nice report. If you do want to go into more detail, we have an instant trend report that takes it to an Excel sheet, and then that will then go into a bit more detail, and you can cut and dice the information. So there's tons of reports on here that you can use, detailed care reports, observation reports, everything that CQC need. And we've also got some staff reporting as well, so you can evidence that your staff are reporting as and when they need. But have a play about with these. They're really fantastic, really easy to use as well. So S3, which is safeguarding Chloe 3, how does a service user make sure there's sufficient numbers of suitable staff, keep people safe, and their needs are met? So what we have dependency reports, and we also have staff area on the CareBeans platform. So what we have here within the staff area, you've got staff management, you've got employment compliance checklists to ensure that the staff that you are employing, they have the relative, they have the exact checks that you need them to do their job. And then within the report management here, we do have dependency reports. So you can do it by service user, you can do it by care plan if you wish. You can really drill down, or you can obviously put service user's name in, and then you can generate the graph, and it will show the dependency of an individual. And then you can demonstrate how many staff you have for that individual. And this will then be an up and down if obviously the review's been done as well. Okay, so that's how you can make sure there's sufficient number of staff and people safe and meet their needs, obviously via the care planning as well. So Chloe, number 4, S4, how are people's medications managed so they receive them safely? So obviously we have a care plan, so we have medication care plan, and we have safeguard incident forms. We have a medication management system. We also have an integration partner with Atlas EMR. So if you do want a full-blown EMR, we do have the integration with Atlas. Please contact us if you want more information. We have medication records and medication care plan, mental capacity assessments as well. So on the system here, I will go via this route to sign in. So on the system here, we do have a medication section here. So within here, this is where you can add what medications an individual's on. You can have the name of the medication. And if you start typing a medication, it's automatically got all the medications or the regular medications. So we've got a tramadol, for example. It automatically highlights them to you, what the route of mission is, medication type, how is it, how assisted, administered, self-administered, what the medication type is, reason for medication, and then when's it given. So what you can basically do after you've done that, you can save the medication. When you go on to the service user, so if we go on to the service user here, you can create a medication care plan. We haven't got one. Oh, yes, we have a medication care plan here. And you can create an action if you want, so morning meds. And that will then show up for the carer to provide morning meds. And you can list the meds if you want to on there. Very easy. We also have consent, and we also have a medication consent form. So medication administration. So if you view that, it will then bring up, how I want my medication delivered. I need to take daily medication to treat various health issues and manage symptoms. And then Sally doesn't have capacity. So we have to do, well, we believe she doesn't have capacity to provide consent. So we then have to do a mental capacity assessment, which is a list of questions, and it goes through. It's after the mental capacity assessment, it's still assessing that she doesn't have capacity. So do you wish to do a consent form? No, because she doesn't have capacity. It'll automatically take you through to the best interest assessment. So you can go down, do the best interest assessment. And then here, the Court of Deputy for Health, which is Sally's daughter, is Court Protection Deputy Lucy Smith, and she will then sign consent given over the phone, but she'll review it when she gets here. So again, that's how you can ensure that you're keeping people safe, and obviously that people's medication management, so they receive them safely. You can obviously put a care plan in place as well. So we obviously have a medication care plan here. So Sally needs medication administering, what are the goals, and then you've got all of the person-centered information there as well. So that's how we provide that process for them. If there's any risks, obviously she's allergic to penicillin, so we have an allergy risk. Obviously, please ensure that all food allergy report to staff. She's allergic to penicillin. Sally is allergic to penicillin. We have a severe risk there, just in case if she is given it. Hopefully she's not. It is possible. People do make mistakes. And this will highlight the risk. So you can ensure that when you're doing the care plan and the care actions, that you're putting the appropriate actions in. And you're covering every base by doing consent and mental capacity assessment as well. So that's how we cover the S4, how people's medicines are managed. S5, Chloe, how well are people protected by the prevention and control of infection? So again, what we have the care plan, so you can do an infection care plan. We have the preset text in the support care plan reviewing as well. So what we've basically done in the system here is Sally hasn't got an infection care plan, I don't think. No. If she did have an infection care plan, we can obviously make this live by saying review, activate the care plan. For example, we can then write the review. And then down here, what we basically have in each of our care plan section, we have pre-configured text that you can then alter and adjust if needed. So Sally is at risk of infection due to, and it may be pressure ulcer or a lump in her leg. Sally has an infection of the lower limb, whatever it is. And then you can change the information, obviously. You can change the colors of it. You can change the text size. You can do lots of things. What are the service users' desired goals? So again, we have a list of goals, all Sally to support required us met in this area so that Sally can remain as independent as possible and be infection-free. And then we have the support required. So we've got a standard set of actions for you. We're not saying we're the be all and end all, but we do have a nurse team that works with us to ensure that everything on here is applicable to CQC inspection as well. So here, the X's basically means you need to alter it and adjust. If anything's not relevant to you, you can delete it as well. You can take it out the plan. But this will give you a basis of a good, solid care plan. But please add your own, obviously, person-centered information. You can see we person-center it. The lady's name, Sally, is in every single one of these, so she's already in there, so that's all nicely kept. So that's how well people are protected and prevent and control of infection. And also you review the care plan. So under here, the next review, it automatically will give you the next review date. You can set that whatever you like. If you set it for a month, you don't need to change the date, but it might be something you're reviewing every week. So again, you can put your own review date in there as well. So that's how we do the Chloe 5. How well are people protected by prevention and control of infections? Quite straightforward. We also obviously have incident forms as well, so that can also cover it if needed. If there is an incident regarding an infection, probably not, but you never know. So here, next, we're going to go on to Chloe 2, which is effective. How do people receive effective care? Which is based on best practice from staff who have the knowledge and skills they need to carry out the roles and responsibilities. So again, I've pretty much gone through this. We've got the care plan, we've got the actions, and we've got the staff sections. So going to concentrate a little bit, obviously, on the care plan. You've obviously seen the care plan. We have the eating, drinking care plans. From that, you create the appropriate care actions. So here on the care actions here, you can then say, we've got a fluid chart in place, a food chart, a monthly weight, and a mouth care chart. So what will then happen if we're on an individual such as Sally Hall or Sally Webb, these are all of her care plan actions. And you can see they will start flashing. So we've got a fluid chart here. So it's actually saying that we need to provide some fluids, and it's very simple for the carer to write in what the person's had. They can use Google Voice if you're using a mobile, and then this will give you how much fluid she's had. If any of these are needed now, it will then be flashing at the carer. So it can ensure that people are receiving effective care via the care plan and the actions that you provide via the care plan. The staff section. So what we have here under staff management is you can create employment compliance checklists. So, for example, we've got lots of checklists. We've got a DBS check. We've also got, obviously the namings of this aren't great. We've got an application form. So, because this is our test system. But when it comes to staff, when creating a new member of staff, you can put in a checklist. So your employment compliance checklist, it'll now say add new check. So within the care side of things, these are all the things that need to be done to ensure that the new staff member has all the necessary checks and all the necessary authorization. So it may be a DBS check, copy of their passport, acceptance to work, they've signed their contract. So basically it's a checklist for you to ensure that people are ready to work for your organization. So E2, which is effective Chloe 2, is consent to care and treatment always sought in line with legislation and guidance. So consent for care, this is a really big thing on the system. We have obviously consent, mental capacity and best interest forms. We have care plans, incident forms, DOLS authorizations and DNAR documentation. So the care plans, we've got evidence in the cognition and behaviour care plan, how to deal with behaviour that challenges others, including decisions of restraint. We've obviously got the incident accident forms. Any use of restraints can be recorded appropriately in the care plan or behaviour incident form, ensuring any use of restraint on someone who may lack capacity is clearly monitored and action is taken to minimise its use. We also have the ability to upload DOLS authorizations and DNAR. So I will show you that part of the system now. Without saving. So if we go on to here, we have a document library. This is available to everyone to see. So Has the person got a DNAR? If they have, you can upload the certificate and the DNA start date. This is your LPA documentation, and then you have your DOLs, so you can actually add your DOLs into the system as well. And these can be uploaded to ensure staff know where they are in one place, and you can evidence in all the care plans that these are being monitored and done in the least restrictive way as possible. And as I said, we've got the DNAR upload as well. So that's how we're covering consent and treatments. And obviously you have the meds capacity forms, which we went through earlier in quite a lot of detail. So within the care plan, you have the consent and med capacity, and you can add a new capacity at any time. You can select a consent reason, and you can add your own consent reasons in. And then you go through the process. If they're able to give consent, if they're not, it will take you through the process of the consent form for you. It's pretty straightforward. The questions are there for you to answer. So E3, effective Chloe. How are people supported to eat and drink enough and maintain a balanced diet? So again, what we have is we have an eating and drinking care plan. We have food chart, fluid charts, and fluid targets. So as we can see on here, we'll leave the information there. We'll look for Sally. So we've got Sally Webb or Hall, it doesn't really matter. We have an eating and drinking care plan, which details all of her issues. Not only issues, what she can and can't do. So it's a really, really well written care plan there. And then she's got risk of dying if diet's not softened, risk of malnourishment, because we've done a must tool. So the must tool is actually assessed as high risk, as you can see here. And then what we basically then do is we provide care actions. So we have a fluid chart, food chart, a monthly weight chart, and mouth care. So the carers can then go onto the system, identify, and then these will be flashing when they need to be done. So if it's daily, weekly, monthly, hourly, these will be done. There's a simple food chart here that you can click, and you can do this offline on our app as well. You don't have to be online to do that. And you say she had breakfast, she ate 25%, porridge, she didn't want the rest. You can alert managers and handovers as well, and then done. And that will then tell you when you next need to record. So they need to record in 3 hours. We're keeping an eye on that. And then you can put your intake in. So she might have had 500 mils of water. And she had a good drink this morning. And again, on these as well, you've got all the care instruction. So it's all there for them. So you can see the care instruction for the individual client. So not only can you see the action, you can see the care instruction. And also this little heart in hands here, this gives the ability for the carer to actually read the care plan as well, all from one screen. And that's a pretty unique function that we have on our system there. So E4, how are people supported to maintain good health, have access to healthcare services and receive ongoing health support? So again, that's pretty much all to do with the proper care planning, identifying the needs, identifying the goals, and identifying the proper support. And we do that via our care plan process. We also, as I said earlier, we have the ability to do pre-written statements as well, so you've got a basis of your care plan, and they're very easy to write. Get in contact if you need any information on that. And then E5, how are people individual needs met by the adaptation, design, decoration of the service? And again, I'm not really going to show you anything on the system. It's more through the care plan. So again, you can pretty much see from each individual care plan, these are individualized to the individual's requirements. And then the actions are individualized to the requirements as well. So you can see Sally has a preferred routine. All of these requirements need to be met. And then here is a list of all the information that's needed for Sally's person-centered details. So that's Chloe effective, finished. Next one, Chloe 3, caring. How are positive caring relationships developed with people using the service? And again, that's pretty much through the care planning process. And that's all to do with the individual care plans and how you write them. So make sure you write them in a positive caring way. and this will obviously make sure care and relationships to develop with people using the service. So that's through the care plan process. Caring. How does the service user support people to express their views and actively involve in making decisions about their care, treatment and support? Well, again, you've got the care plans, you've got the actions, and also you have all of your mental capacity assessments and consents to make sure that they're involved. And also on the review page here, if I do a review, I'm going to conduct a review on our washing and dressing care plan. If she has consent and capacity, Sally can physically, or her daughter every month can come in when she comes in to see her. She can physically sign to say that she's happy with the plan of care and what's happening. And she can go through and you can do the bed rails assessment. You can save that assessment. You can go through the care plan with the client. You can go through the risk profiles to make sure that they're all correct. You can go through your consent again to get consent if you need to update the consent form. And then you can just literally save and publish the form. And that will then conduct a review. And then the next review is the end of March. So it's got a 28-day review period. So that's how you can do that. How people ask, how is people's privacy and dignity respected and promoted? And again, that's all through your care plans and actions to ensure when you do write a care plan, within here, you've got all Sally's support required and met, so that Sally can retain her independence possible and her privacy and dignity maintained. And this is all through how to write your person-centered care plan. So again, you've got Sally, support Sally using bath, using her favourite toiletries. She prefers a female carer. Sally will inform you, staff, if you want to have hair washed. Support Sally to address appropriately, promote independence, self-care where possible, and what she can and can't do. So these are all through there, and dignity and respect is promoted via the care plan, and then the person-centered actions off the care plan. Caring number 4, how people are supported at the end of their life to have a comfortable, dignified and pain-free death. And again, that's through the care plan process. So what we have on here, I'll return to the care plan suite. She obviously only has 6, but down here we have an advanced care plan, and we also have a final days care plan. So within your final days care plan, if we just stick this onto active, and I can show you basically how are people supported at the end of life to have a comfortable, dignified and pain-free death. So what you can basically do here is you can write the care plan. And again, we've got some fantastic palliative care needs already written for you. Sally's in the last few hours of death, so you obviously change what. Sally has breathlessness. Sally may wish to eat and drink. Really important, what are the person's desired goals? And then the instruction, what are you going to do to make sure that she has a dignified and a pain-free death? Assess the management reversible cause of breathlessness. Assist Sally to repositioning. So all this is already written for you. You may delete some of this. This is everything. This is basically the gold standards framework for end of life for the last few hours, days, weeks. So you can obviously, you can basically adapt it as you need it. But this is already written for you in the back end of the system. So it's really, really easy to adapt and make sure you're person-centered. It's person-centered. We put the person's name in the text already. And you also have details of advanced decisions to refuse treatment. So if she does have a DNAR in place, make sure that is obviously respected as well, so she can have a dignified death. And then you can put some care actions in, so you can add some care actions in if required, save and publish it, and then that will then give you a really good base for how people are supported at the end of life to have a comfortable, dignified and pain-free death. So that was Chloe number 3, which is caring, which is quite a lot in regards to the CareBean software. Responsiveness, how do people receive personalised care that are responsive to their needs? And again, we've spoken about this already. It's about how you write your care plans and what you write in your care plans, and how you then write your actions for your carers to deliver the care from your care plans. We do have life story, about service user and interest forms to make sure that everything's personalised to their own individual needs. So if we go back to the service user dashboard, we do have a section which is this head and body. So if we look in the head and body, what we basically have here is we have all their personal detail, pre-admission and history. We have all about the contact and family. And then you have about the service user, identify characteristics to make sure it's all personalised, what their interests and hobbies are. This is all available to the carer as well at point of care. And then my life story. So you can make sure that you've got as much information about the service user so you can provide personalised care for the individual, as they're all individuals and they will have different ways they want care provided. You've got a photo gallery, you've got a personal inventory, you've got all their allergies. And again, we have this section here, medical alerts. Please make sure that you use these. You can do what they're capable of doing themselves. Do they need general alerts? Is there any communication issues? Are they a diabetic? Any dietary requirements, palliative care? Is there any behavioural issues? Is there falls issues, doles, choking, COPD issues? And then down here, is there any fluid targets? Any of these you switch to yes. These will then provide for the carer and the staff, when you're providing care, it will actually show them up here so they can read if there's any issues with eating and drinking, falls, what they're capable, a doles is in place. So all the care and all the information is there for the individual to provide person-centered care. Responsiveness. How does the service user, number 2, how does the service user routinely listen and learn from people's experience, complaints and concerns? You should evidence that people's concerns and complaints are listened to, encouraged, explored and responded to. So what we basically have there is we are producing a suite of audits that allow you to capture this information and evidence that you are acting accordingly and used as an opportunity for learning and improvement. So we are going to be introducing some audits such as, and we're listening to our customers, we're going to be producing listening forms, staff surveys, also resident family surveys, and these can all be added to the system. At the moment, the best place to obviously put all these is you'll probably have these forms in place and you can still add them to the service user. So in every single service user's, sorry, we're going to use Sally Webb. In every single file, we have a document library down here. And within the document library, you can then add any forms you wish. So you might have some listening forms. So it might be a form that you fill in with the resident's family. You might have assessment forms that you might want to put in that you do with the residents. So this is how you can ensure that people's concerns, complaints are listened to, encouraged. Obviously, concerns can also be used via the instant recording as well. You can raise any concerns there as well, but you can add your own forms in there if you need to. So next one is the last one we have, which is Chloe number 5, well led, and that's for the management. Not only for the management, the whole service really, but how does the service user promote a positive culture that is person-centered, open, inclusive and empowering? Staff and service users should be encouraged to be actively involved in developing the service. If a staff member raises a concern or a safeguard issue and documents on the care planning system, then it's vital that staff are made to feel supported in doing this and are protected. So I showed you that earlier from our safeguarding part on the incident accident recording. The care plan should reflect the set of values a service has, such as involvement, compassion, dignity, independence, respect, equality and safety. Staff appraisals, to record the outcomes of meetings with staff, how they feel, where they feel they may be able to improve, as well as what they feel are doing well. So obviously on the system here, we have on your staff management, within each of your carers, you have skills and work certifications area. You also have a document library, employment compliance, and then you have staff reviews. So you can actually add a staff review in for an individual service use. So that's like an appraisal. We are adding another appraisal section and we're going to be adding a lot more on the staff section, but you do have the ability to do a staff review. So if I search for a member of staff, I'll search for myself. I've probably had a staff review, and here's my last review. So what the summary of the review was about, the performance regarding the service users. So how many sick days have I had? when the next review is due, performance regarding health and safety, performance regarding nature of work, performance regarding teamwork, details since last review, further training needs, and overall performance of the staff. And that can be then saved. And you can do as many as you like on different areas. And this is where the review summary will be. Okay. So that's how you can do, how to make sure that you can promote a positive culture within the system and demonstrate it to CQC. How does service use demonstrate good management leadership? Obviously, we've got incident forms, reporting, and care plan training. We do have the ability to provide mock CQC inspections. So if you are interested in them, please get into contact with us. You can do it via the website, or you can contact us, info@carebeans.co.uk. We can provide some information on that. And we do have a nurse team within that can assist you with care plan training as well. And then you've got the incident forms and you've got reporting. So we've gone through the incident forms there. And then we have a suite of reporting. So we've got detailed care reports, observation reports, history reports, analytic error reports, dependency reports. You've got every audit you want. So you can audit care plans, you can audit who's created a care plan, who's changed one, communication notes. You can basically do anything on the system. Care provider risk summaries, incident trend reports, incident summary reports, care activity summary reports. So if you want to see what a certain carer has done in a certain period, you can write, service user or someone's carer's name down, generate the report, and then that will then generate it in an Excel format if you want to do a care report as well. So there's lots and lots of different reports that can be provided for you. How does the service user deliver high quality of care? Well, that's from the start of the system all the way through to the end. So that's all about care plans. Make sure that you print all your audits and they're ready. CareBeans product, service and implementation, ongoing support. So again, make sure that you contact us if you've got any issues with the product or service implementation, and we'll be happy to help. And obviously you get the ongoing support from our team. We're very, very, we feel that support for our customers is extremely important. And that is a thing that we do focus on, and we do highly rate our support. And I think it's one of the best within the environment of the care sector. And then W4, well led. How does the service work in partnership with other agencies? So audit to evidence to clinical commission group KPIs, local authorities and safeguarding teams support care provision, service development and joined up care. So obviously within this part, what we can do is we've got examples of Sally Wed. So we've got consent and mental capacity forms that you can use and you can print them off. So if, for example, someone wants any information out of the system, we have the ability to print. So if you want to do a care plan report, there's a simple reporting function here to say, I want to see all the reviews, I want to see all the history and the risk profiling for Sally, generate the report. And if someone wants this from an outside agency, or it may be social services or an inspector, this will then provide a simple, quick and easy report. It will give the list of every single review you've ever done in one quick and easy report. You can also do that, for example, if the skin integrity team come in and they want to see the Waterloo assessments you've done, you can obviously, you can use the little filters to come up with Waterloo. If she has one, it might be that the nutrition team want to see her must-tool. You can then show the history, generate. This will then give the scores, and you can go back to whatever dates you want on these. So if you want to see a whole year's worth, they might want to see 3 months worth or a year's worth. You can go back on here, you can apply the filters and then generate, and it will show you the actual assessments if there is any for that period of time. So what we try and do there, we obviously have the evidence-based risk, we've got the care planning, we've got the risk assessments. To do that, you can pretty much print everything from the system. So if anyone does need anything, such as family members might want to say, how's my mum been the last 7 days? And there's a simple report that you can print off. So we can provide information to other agencies. For inspectors, we have the temporary inspector login. Okay, so within here, you can actually put the inspectors. So it might be a CQC review, and then you can give them a time period of when they can go in and out the system for them. Usually they do this on site, but remotely you might want to provide them remotely. You can do, but it's not ideal. And you can select the residents. So if they want to see 3 people's information, you can actually lock an agency down to one individual's care plan. It is all read only, so it doesn't matter. They will not be able to change anything on the system. So this is how we audit to evidence clinical commission groups at KPIs, local authorities and safeguarding teams to support the care provision. Obviously, with the safeguarding and all of these, with the instant reports, these can all be printed as well via the report management section if you need to. So it's all there for you. So examples of good practice when care planning and recording. So Sally Webb, consent and mental capacity assessment. This is an example. Consent and mental capacity assessments are in place to demonstrate capacity has been taken into account when care planning and appropriate advocacy is provided. Evidence-based risk assessments to identify risks to support the care planning process. Care plans, person-centered care plans to evidence involvement for Sally and the advocate. Risk assessments in place should any further risk be identified in the plan of care. So examples of good practice when care planning, again, an extension is actions in place to support the care plan in the least restrictive way possible, a way of evidencing that support was given and handed over appropriately and relevant action taken. Reviews to ensure that the plan of care is working, review status in green, amber and red. So if it's in green, it's in time. If it's amber, there's a week to go. If it's red, it's overdue. It needs reviewing. Accident reports to ensure all accident incidents are recorded and action taken to reduce further risk of happening again. And then we have the reports. So we have care summaries, action reports, care plan reports, observation reports to enable data to be captured in a way that makes it easy to audit and plan care appropriately and in line with the ever-changing needs of the client. So that's just a little summary that I wanted to go through at the end. Thank you for attending and participating in today's webinar. We'll have a Q&A. I won't record the Q&A, but if you are an existing customer and you need some information, we have a new phone number here. Just make sure you use our new phone number and our email address, info@carebeans.co.uk, and the website is www.carebeans.co.uk. Please don't hesitate to obviously have a look at that. And we have a care home system, domiciliary care system, staff rostering, and a new time and attendance system as well. So if you're interested in looking at them, please get in contact with us. I'm going to stop sharing before we do the Q&A. Thank you very much for attending today, and I look forward to speaking to you on our next one. Our next webinar is next month, and it's about cyber security and data within your care homes. And look forward to you signing up on that, and we will speak to you soon. Thank you.